it's not just about using herbs. There's no magic ingredient. If you're dealing with somebody who's chronically ill, cancer, anything else, these are all things that, and this is just the beginning of the list. You've got to use your judgment as a clinician. You've got to take care of the people. You've got to make them healthy. They've got to be eating right. They've got to be drinking water. If their gut's out of balance, you've got to deal with dysbiosis and parasites if those are out of balance. Nutrition, detoxing, however you do it, just do it. Emotional detoxing, really important. And we could spend a whole hour talking about just beginning to talk about that. And stress management, just put the slide up just to remind you, as you read through this, that all the things you've ever been doing are just as important as they ever were. The purpose of this talk is just introduce you as to what else could you do if you identify someone as being in the cancer timeline and now you want to do something about it. How would you specifically address that? And I mentioned emotional toxicity, Dr. Hammer, Claude Sabat, Gilbert Reynaud, those names are in your handouts. How the stressors and conflicts that challenge us settle into our bodies. So just real quickly, I'll tell you a story about Hammer. And Bill, Corey had met Hammer. Hammer is actually still, he was in Germany. Real quick story. His son got involved with some shady businessmen in Sicily. And he ended up getting shot and a business deal gone bad in a boat in the Mediterranean off Sicily. He didn't die. They got him back to France. And his father went there. And for 3 months, they tried to save his life and they couldn't. And so now his father's faced with, he wasn't man enough to save his own son's life, even though he was a very good doctor. He isn't man enough to bring justice. There's never going to be any justice in this case because of the people involved and where it occurred. And he lost his son. What happens? 3 months after all this settles down, he finds a lump in his testicle. He gets a biopsy. It's a testicular tumor. Now, he's an oncologist. He knows this is not a disease that affects brain 50-something oncologists. This is the disease of young men like Lance Armstrong. This is pretty bizarre. So he didn't do anything. And he started going around, he started asking all the other people that were in the hospital at the time who had testicular tumors, what's going on in your life before they found this? He started going back through his own records, because a lot of people survive testicular cancer. Even using Western, it's a cancer that a lot of people survive. He started going back and asking questions that he never asked in his clinical practice before. What were the stresses in your life? What kind of conflicts, shocks, what sort of things were happening? And it wasn't one story, it wasn't his story, but he found a story in everyone. And then he started looking at other tumors. And so he sort of put together this notion of how to look at tumor at the end of his days. And he got into trouble in Germany not for malpractice, not for the bad practice of medicine. He got into trouble because he was a real outspoken guy. He was standing on the rooftops. He was shouting, "These fools are killing you. They don't know what they're doing. They have no idea what cancer is about. They're idiots, and you shouldn't do anything they say." And so he was taken to trial for disruption of the peace, disruption of the public order. And in the middle of the trial, the judge said to the prosecutor, "Well, Dr. Hammer's main defense is that he was helping people. Was he?" And they go, "We don't know." They go, "Well, you confiscated everything out of his office. I want you to go back. I don't care how many weeks it takes. I want you to go through his records and figure out how many people did he help." So it took them weeks and weeks and weeks. They came back and they said, as best we can figure out, using what the doctors tell us to use, 85% of the people he treated, just by talking to them, were still alive 5 years later. Now you have to realize, when I talk about how the integrative oncologists are saying we haven't been doing any better than we were 50 years, for all cancers, the effectiveness of chemotherapy is 2%. 2% of people. And so there are some cancers where a lot of people survive. There are some cancers where everybody dies. But all cancers together in this country, survival using Western techniques is about 2%. 5 years. Okay? That's pathetic. And so when doctors complain about, well, why would you want to do this silly interventional thing? A lot of patients, when they start really delving into it and they start doing the research and they start looking at outcomes, yeah, this drug you want to give me, it'll shrink my tumor, but nobody ever lived any longer. They start looking at outcomes, they go, well, I'm going to do this silly alternative thing because what you're proposing to me doesn't work. I want something better than 2%. And I include this work with Hammer here because I just think this whole thing with the emotional realm is really important, no matter what disease you're dealing with. Hammer said all diseases. You don't need to make a distinction. And how are we doing for time? I'm way over time? Okay. I'm going to tell one story anyhow. Just a real quick one. I used to go down and I'd sit with Bill. One of the days that I was there, he told me the story of a guy who had lived many years. He had a blood tumor, leukemia. And in talking with him, Bill said, well, what's going on in your family? This, sometimes the poetry makes sense. If you're dealing with leukemia, you're dealing with a problem of your blood, your family. And short story, this guy had had a lifetime of conflict with his brother. He said, if you want to live, you got to work that out. He goes, what am I supposed to do? He goes, I go live with him and work it out. He goes, what do you mean? He goes, well, you want to live? I'd go knock on his door and live with him and hammer it out and figure out some way to be different with him. And he did, and he was alive many years later in a tumor that had already been treated in remission, then recurred, and they're telling him they can't do anything for him. And wasn't the only thing he did, but probably is one of the reasons he lived. And then just this last slide. This paper by Judah Folkman, there's going to be more work like this coming. This is just from 2006. But the role of angiogenesis in human tumor dormancy. This is the work I was referring to before. And this is from the article, Microscopic Human Cancers Can Remain in an Asymptomatic, Non-Detectable, and Occult State for the Life of a Person. Okay. And as you start thinking about this cancer timeline, cancer is a 12-year disease. Emotional stressors like in Hammer can cause something to appear in 3 months. You begin to go, oh, this doesn't all fit together. How does this, this things can show up based on a conflict or a stress or a thing, and yet it's a 12-year disease. And I think I don't want to cause conflict, and I don't want to make your brain explode, but this is the way to begin to understand. And if you don't understand anything else, just realize that just because you find a tumor doing whatever you're doing for screening doesn't mean you have to jump on it. It doesn't mean that because you find a little that's needed is radiation and lumpectomy. And they're not brave enough to do those studies here. They're doing them in Sweden. They're doing them in Europe. And cancer isn't the disease you think it is. So I'm going to end there. We'll have time for questions after. We'll kind of let Lisa get going.
Yeah, we'll take about a 10-minute break.
Good.
We'll switch over with Lisa, so we'll see you back here in a few minutes.